Let's start with a statement that could change your life. Breast cancer can hide in plain sight, and knowing the warning signs can save your life. It's a serious topic, but one we need to talk about openly and without fear. This is especially important for us as seniors. As we age, our risk for developing breast cancer naturally increases, and sometimes the most critical symptoms are subtle ones that are easy to overlook or dismiss as just another part of getting older. The purpose of this video is to pull back the curtain on these important warning signs. We will reveal the signs that are often missed or ignored by women, especially seniors, to empower you with the knowledge you need to be vigilant, proactive, and seek timely medical consultation. Breast cancer and aging. What seniors need to know. The numbers tell a story we need to hear. Did you know that about 2/3 of all invasive breast cancers are found in women who are 55 and older? This statistic highlights why this conversation is so critical for our age group. Our risk is higher, and therefore our awareness must be higher too. As we age, our breast tissue naturally changes. It often becomes less dense and more fatty. While this is a normal process, these changes can sometimes make it harder to feel a new lump, or they can even mask or mimic the symptoms of a problem. This makes it even more important to know what you're looking for. This is why early detection is so absolutely crucial for seniors. Catching breast cancer at its earliest stage dramatically improves the chances for successful treatment and better outcomes. Since older adults may have other health conditions or respond differently to treatment, finding it early gives you the most options and the best possible path forward. Common and hidden warning signs of breast cancer. When we think of breast cancer, certain common signs usually come to mind. We've all been taught to check for lumps and to be aware of things like unusual nipple discharge or persistent breast pain. These are, without a doubt, very important warning signs. However, many of the most critical clues are often overlooked. These are the hidden or silent signs that can be easily mistaken for other, more benign conditions. Subtle skin changes, for example, might be dismissed as a simple rash. A little bit of swelling might be blamed on sleeping in an odd position. These are often mistaken for normal aging effects. This is why self-awareness is your most powerful tool. It's not about being a doctor. It's about being an expert on your own body. The importance of knowing what is normal for your own breasts cannot be overstated. When you know you're normal, you can spot abnormalities early. Detailed warning signs. Your breasts may be hiding cancer, new lump or thickening in the breast or underarm. The most well-known warning sign of breast cancer is a new lump or a noticeable thickening in the breast tissue or in the underarm area. A concerning lump often feels different from the rest of your breast tissue. It may feel hard, like a small pebble or stone. It might also have an irregular shape rather than being smooth and round. Another key characteristic to watch for is a lump that feels fixed in place, as if it's attached to the skin or the tissue deep within the breast. It's also critical to pay attention to your underarm. A new lump in the underarm or around the collarbone area can be a very serious sign. These areas contain lymph nodes, and a lump here may indicate that the breast cancer has begun to spread. We want to be clear, not all lumps are cancer. Many are benign cysts or other harmless growths. However, any new lump or area of thickening that you discover needs a prompt and professional medical evaluation. Changes in breast size, shape, or symmetry. It's completely normal for women to have breasts that aren't perfectly identical. However, a new or noticeable change in the size, shape, or symmetry of your breasts is a warning sign you must take seriously. This might present as a visible swelling that makes one breast look larger or feel heavier than the other. In some cases, you might even notice a shrinkage in one breast. You might also see a distortion in the shape of the breast that wasn't there before. The key thing to remember is that these changes can sometimes happen even without a distinct, palpable lump that you can feel. It's the overall change in appearance that is the signal. Skin changes on the breast. Your skin can offer some of the most important, yet most often dismissed clues. Be on the lookout for any dimpling or puckering of the breast skin. This is a classic sign often described as having an orange peel texture where the skin becomes pitted and rough. Another major warning sign is any unexplained redness, scaling, or thickening of the skin on the breast or nipple. These changes can be very subtle at first. You might think a patch of red or scaly skin is just a bit of minor irritation, a rash, or a mild infection. You might try putting lotion on it, expecting it to go away. However, if these skin conditions persist and do not clear up quickly, they need to be evaluated by a doctor, as they can be a sign of a specific aggressive type of breast cancer. Nipple changes and discharge. Your nipples are another critical area to monitor. One of the most significant warning signs is a nipple that begins to turn inward, a condition known as nipple inversion. If one or both of your nipples have always been inverted, that's your normal. But a new retraction or inversion is a red flag. Also, look for any rash-like changes or persistent scaling on and around the nipple. Furthermore, any nipple discharge that is not breast milk needs immediate attention. This is especially true if the discharge is bloody or clear, and if it comes out spontaneously without you squeezing the nipple. Any of these nipple changes could signal a problem within the milk ducts and should be reported to your doctor. Persistent breast or nipple pain. While it's true that most breast cancers do not cause pain, some do. For this reason, persistent or unexplained breast or nipple pain should never be ignored. We aren't talking about a fleeting ache, but rather a pain that is focused in one specific spot and does not go away. It's easy to dismiss this as a pulled muscle or something minor. But if that pain lingers, especially if it is accompanied by any of the other signs we have discussed today, it absolutely warrants a medical checkup. Think of pain as your body's alarm system. It's telling you to pay attention. Swelling in the armpit or collarbone area. As we mentioned briefly before, any swelling in your armpit or around your collarbone is a significant warning sign. These areas contain clusters of lymph nodes. Swollen lymph nodes may be one of the first outward signs of cancer spread, sometimes appearing even before a lump in the breast is large enough to be felt. This swelling deserves immediate medical attention. What to do if you notice these warning signs? If you notice any of these warning signs, from a lump to a skin change, the most important thing is to take action. Please don't ignore the sign and don't delay making a call. Your first move should be to schedule an immediate medical consultation with your doctor. In the meantime, continue to practice regular breast self-checks. The goal of a self-check is to become so familiar with your own body that you can notice changes as soon as they appear. During your doctor's visit, you can expect a thorough clinical exam. From there, your doctor may recommend imaging tests like a mammogram or an ultrasound to get a better look. If needed, a biopsy might be performed to get a definitive answer. Remember, the importance of follow-up is huge. Early diagnosis directly leads to better, less invasive treatment options and much better outcomes. Overcoming common barriers to seeking help for seniors. We know that making that call to the doctor can be difficult. It's very common to feel fears related to a potential diagnosis. Some people experience embarrassment talking about their bodies, while others may be in a state of denial, hoping the problem will just go away on its own. We encourage you to find the strength to overcome these barriers. Engage in open communication with your healthcare providers. They are there to help you without judgment. Lean on your loved ones for support. Please remember that seeking help early is not a sign of weakness. It is a profound act of strength and responsible self-care. Conclusion and call to action. The key message we want you to take away today is this. Breast cancer can hide behind many subtle signs, and this is especially true for seniors. Your health is in your hands. We hope you feel empowered to stay vigilant, to perform regular self-checks, and most importantly, to consult your doctor promptly if you notice anything unusual. Your action could make all the difference. If this video was helpful, please share it. Help us raise awareness by sending it to your friends, family, and peers. And please subscribe to our channel for more senior health advice and important updates. Thank you so much for watching.